Today on Jay's Corner, what we're going to do is going to be sitting up here. Let's just take a quick look at the agenda here for today. We're going to be quick, within an hour. Here, it's up here on your screen. Here's our quick agenda. We're going to talk a look at ChatGPT and whether or not it can do what roles it can and cannot fill when it comes to financial information. We'll talk about Medicare. There are some updates with regard to the way that we're going to communicate, that people in the marketplace communicate with consumers. And then in addition to that, I'm going to give you a sneak peek at the book revisions. A new edition is coming out early in next year, 2024. We're at work now. We know most of the changes. We don't have the details with respect to premiums and the actual cost sharing figures. That will be the last moment update before we hit print. And then I'll talk about financial planning. I attended as an education fellow at the Alliance for Lifetime Income. The website is protectedincome.org. Illustrious panelists, and I'll talk about my takeaways here, what I learned, and things that everyday people can take away from the very highest end of people who are there to educate the professional crowd. With all that out of the way, let's just get started here. So what we have here is, and of course there's going to be problems. As always, the videographer is not great. So let's just see if we can get to the right spot. We will. I'm very confident of that. Let's just see here. Nope, that's not it, is it? Here we are. So this is ChatGPT, and what I've done is I have spent pretty much the last 6 months exploring what the capabilities of ChatGPT were. The moment I saw it come out, I have been tinkering pretty much around the clock. We've deployed multiple people to work on projects that will utilize artificial intelligence to try to help create information and models for people that they can use, that we're going to use in order to help people with every stage, whether that be an individual situation or a consolidated, integrated plan. We'll get to that at the end of the video. Here is just one example, and so you can see here that what I've put here on the screen, and the entire key. You can remember that when Google first came out, search engines came out, yahoo.com, AOL.com. I don't even remember what the altavista.com. I'm dating myself, right? If you're a millennial, you have no idea what AltaVista is. The key thing here is how to create the prompts. And by prompt, what is the nature of the way we are going to ask the questions, right? And so let's just blow this up here so it's better for viewing. And here is what I did. And I typed this in advance. I've not hit return yet, but this gives you a feel. So what I did is I asked the ChatGPT, put yourself in the shoes of a married couple with one spouse 64.9 years old. In other words, just prior to Medicare. One spouse 62 years old. In simple language, describe how to consider healthcare cost options. So with that, let's just see what artificial intelligence comes up with, and let's just take a quick look. And we won't share a link to the chat. Actually, I will. What I'm going to do, let's see if I can get it. Oops, nah. I'm going to put a link when I get to the... So you can see it here, how quickly it's coming out with an answer. When considering care cost options, there are several factors to consider. Here's a simple guide. Understand your current health status. I like this. So I'm going to tell you now, as after a number of months, the quality of this answer has improved notably. So as artificial intelligence goes through all the information that's available on the internet, that you'll be able to get higher quality answers. And I would say that the principles here are generally okay. So let's just, here we go, understand your current health status. I agree with this and I agree with the ordering. As people know, comprehensive financial planning clients know, there's a reason I started with Medicare, right? Because you need to know what your health status actually is. There are links. We're going to, on the third section, when I talked about the Alliance for Lifetime Income, the summit, the keynote speech at lunchtime was by Professor Emeritus from UCLA. His name is Shlomo Bernatzi. Anyway, he brought up this topic of an health index, meaning the consumer has a view about their health status, and he created a scale. And it's important, and it's important right up front here. It's not only what coverage in health insurance or Medicare you need, it also ripple effects all the way to what your investment horizons look like, to every specific financial topic. Every financial topic has the small letter T. If you are very ill, you're Mr. Sick a lot, you have a family history, your expectations are different than Mr. and Mrs. Perfect. And this is the point here. It's a good point. Medicare eligibility. Yes, of course. Crazy people have written books about this singular topic itself. Right? Medicare, absolutely at the top of the list. Here, the spouse who is 64.9 years old will soon be eligible for Medicare and didn't separate parts. We're not going to cover A through D here. We've got an entire channel. And again, crazy person is writing books about this. We're going to talk about the revisions for next year that I've already prepared. Healthcare for the younger spouse. And this is very, very important. That when I talk to other people and they come to me and say, we are a married couple, one person who is covered by health insurance covers the spouse and is considering to retire, I then immediately focus on the non-Medicare eligible person. The non-Medicare eligible person. Because the Medicare rights and options are in stone. Meaning those are federal regulations. The states have additional regulations which would possibly increase the number of rights and options you have. In addition to that, the carriers, they just have no choice. I have no choice, right? You have specific rights and options. They're in stone. We're going to follow them. Period. End of story. No debate. No hemming and hawing. However, the one where the outcomes can change is actually at the pre-Medicare spouse. The results, the financial results, the access to healthcare provider results is enormous. The ripple effect, the reason I branched out from Maximize Your Medicare to Jay's Corner is because I have known this central fact. And in addition to that, with additional facts that these matters are tax related. As a result, now you can understand my point. Roth IRA, qualified, non-qualified, all related to your taxable income. These, and as a result, I've used the phrase asset location. So unfortunately what we have, YouTube, it's YouTube's world, I'm just living in it. 10-minute snippet to tell you about one specific topic. What's a Roth IRA? What's a 401k? What's an traditional IRA? What can you do as far as rollovers go? There are thousands of articles around this. There are very few articles that say, okay, since the tax implication is this, that affects the health insurance for the younger spouse. Because it changes the price of an option. And this is what ChatGPT does very well here, is that at least it introduces the topic. And this is ultimately your takeaway, which is that artificial intelligence on these different topics that I've written about, on these different topics that I've asked about, it does do a good job of introducing the principle, introducing the thought process. However, what it does not do, as you can see it here, it doesn't do the nitty gritty. It doesn't roll up its sleeves for your situation. They can look into individual health insurance plans either through a private insurer or the health insurance marketplace. All true. The cost and coverage of these plans can vary widely. True. So it's important to carefully review all options. True. In isolation, this is true. We're going to get to the ripple effect when we get down further to the list, I'm pretty sure. Long-term care insurance. Up on the Maximize Your Medicare channel, you have a video where I'm discussing the structure of long-term care insurance as well as how to defray costs if you cannot take care of yourself. I call it the elephant in the room. Nobody likes to talk about it. It's very unpleasant. I don't like to talk about this with my mother. Of course not. The thought is terrible. The idea of communicating about it is unthinkable. Even to yourself in the mirror, the idea of talking about it with an extended family set, very, very difficult. That doesn't mean that it's non-existent. Long-term care insurance here, you can see ChatGPT. As we age, likelihood of needing long-term increases. Nursing home could cover these costs. Important can be high, especially if purchased later in life. This is, again, very good at introducing the topic. Very insufficient as regarding to the different paths, the different options that exist. And of course, almost no mention of price. Let's continue. Health savings account and flexible spending account. If you're eligible, you can consider contributing to a health savings account, HSA, or a flexible spending account, FSA. These accounts allow you to contribute pre-tax dollars for eligible healthcare costs. Eligible healthcare costs here are determined by the IRS. Health savings account, FSA, they work differently. The nuances are not here. In addition to that, HSA does have interactions with Medicare. It does have interactions with Medicare. And the simple reason, as I've reviewed before, the punchline is no one can contribute into the HSA at the same time that you are receiving benefits from Medicare, either Part A or Part B, or Part D, to be candid. You cannot do this. Healthy lifestyle. While this isn't a healthcare cost option per se, maintaining a healthy life can prevent or manage chronic diseases, potentially in the long run. This is beyond dispute, right? I'm not a medical professional. That's why you don't hear me giving you healthy lifestyle advice, right? In the same way, could I learn about healthy lifestyle? Could I have an opinion about healthy lifestyle? Yes, I'm pretty sure that Jack Daniels before 7 a.m., not a great healthy lifestyle, characteristic. That all said, it's not my specific lane. Financial topics, understanding about financial contracts is my lane, right? So you can understand why I don't love the idea that medical professionals be opining about the structure and pricing of complex derivative financial products. And before you, again, for those people who are new here, either to Maximize Your Medicare or to Jay's Corner, right? Don't call me a hater. I liked food when I was a child. My late beloved father, physician. So it's not because of the fact that I think that doctors shouldn't be having an opinion. It's not because a doctor doesn't have the academic wherewithal to learn the candidly not complicated math of derivative instruments. I'm sure that they'll understand the concepts. In fact, I'd be more worried if your doctor didn't understand how probability worked, right? However, the fact of the pricing, the structure of markets, isn't the lane of your primary care physician. It gives you an idea how far away we are from having a national healthcare cost strategy. Congress, when we talk about health insurance issues, Congress calls the AMA. They should be calling the Department of Actuarial Science. They don't. They should be calling the largest reinsurers. They don't. Who do they call? They call the Surgeon General. And that doesn't make the Surgeon General incompetent about healthy lifestyle. Not in the least. Plan for out-of-pocket costs. Even with insurance, there can still be out-of-pocket costs, including deductible coinsurance, to cover these potential costs. Correct? This is also self-evident. It is total cost. And again, it segues back to what I just said. These are derivative contracts. Insurance is an option. It's a derivative contract. As financial planner, as insurance producer, whatever hat you want to put on the top of my head, the issue is that I'm here to optimize total cost within predictable reason, right? I don't have a crystal ball. I presume that you don't either. Will you have a better view of your health index that I mentioned at the beginning of this segment? Yes. And that's why I'm going to dovetail back to Professor Bernard's comments from the Alliance from Lifetime Income. But the issue here is that when you plan for out-of-pocket costs, I understand there are biases on the way that you're fed information. Look at this case, it cost me $10,000. Look at that case I was billed incorrectly for and I didn't understand something. I got an email from somebody the other day, first experience in Medicare. This person said, I had to pay a lot more for a particular eye drop. And I said to that person, we took this into account. We added the total cost. Our guidance was, given that information, that particular Part D plan was most efficient. That doesn't mean every line item is cheaper. We are trying to minimize overall cost. And that's what I'm saying about plan for out-of-pocket costs. It's not only out-of-pocket costs, and in the sense that it gives you an introduction, it's not a complete explanation here on artificial intelligence. Consult a financial advisor or planner. An advisor, I didn't plant this. A financial advisor or planner with expertise in healthcare costs can provide personal advice based on your situation and needs. Partially true. Incomplete again. Jay's Corner, you can see it here. I'm brought it up many, many times, Mr. X. If you please watch other videos here, whether they be the live broadcast or individual videos. I've brought this spreadsheet up multiple times. There's a real good reason. And it comes back to here, which is advisor can expertise in healthcare costs. So first of all, this. There are not many, is the candid reality, right? There's a reason I chose this lane in the world of 6 trillion people who market themselves as financial people. And I'm just going to use it as financial people in air quotes, right? That expertise in healthcare cost here not only is complicated as an individual topic, but more importantly, in a way, is it's fit amongst the jigsaw puzzle of all these rows down here. We're not even talking about the utility adjustment. So what we have is a bunch of different topics that you're given one at a time, right? Social Security optimization. What's a Roth IRA? What's an annuity? What's indexed universal life? They're all viable one by one. The issue is, as I pointed out, this is another topic which happens to be under the expense line and is not therefore as glamorous and as attention-getting as the 1,000-word article in Kiplinger's of, AI, buy all these 5 AI-related stocks. Instead, what I'm saying is, because of the complication that I mentioned earlier, which is the tax, it creates an interaction across these different rows. And now, what financial persons, advisors, and I'm just going to call these people, let's just say, investment advisor for investment alone, Joe Broker, tongue deeply in cheek, Joe Broker, Jill Broker, that this number is enormous. And I wrote in here in this orange, or pumpkin, I guess, minus $25,000. In other words, that is the scope and scale for this couple, depending on where they live. That the difference in performance can be to this degree. I defy someone to say, okay, if they've made a $25,000 difference in a year, that basically moves them up in terms of performance decile when you're comparing different, outcomes. You've changed by multiple tens of percent. So if you were only the 50th percentile, could you have moved to the 70th, 80th, 90th percentile? Yes. But simply this line wasn't fully understood. That's it for the artificial intelligence, basically here. So I segued into these different areas, but there's your takeaway here, which is we're going to be checking back. I do check back. I ask it these same types of questions on different platforms. You can see the picture that I sent out on Jay's Corner in the newsletter. Perplexity.ai, of course, is now my new favorite artificial intelligence search tool because it happens to refer to our favorite book, Maximize Your Medicare. So, rightfully or wrongfully, that's my story, and I'm sticking with it. AI isn't completely, off the rails. Okay, second segment. Let's go here, Maximize Your Medicare. So here, I have begun work. I have begun work on the second or the next edition. And here is the table of contents. I actually did create an entirely different video for paid subscribers to Jay's Corner. So the structure of the book is not going to change. The way, the method of the way to consider health insurance, of which Medicare is a specific type, is unchanged. Why? The analytic framework. Right? Black-Scholes didn't get thrown into the garbage bin and replaced by a different options understanding framework. It didn't. Right? We've spent time here trying to talk about different types of things when it comes to, right? When it comes to different topics and things like that, we have spent a fair amount of time actually explaining the way that the inputs are constructed into health insurance, and its ripple effect then is to price of health insurance, Medicare. Here, The book is there to explain the different inputs and how they affect the way that health insurance works. And as a result, we can tweak the definition of in and out of network. We can tweak what the extra help is. We can tweak what the Part B premium deductible would be and the Part A inpatient hospitalization deductible to be, and what the definition of benefit period is, etc., etc. The list is long. I recognize that. It also is not the full set, meaning that those are the details that if you understand the process, then you can understand what that the individual details will mean. It then therefore may change your conclusions on what's best for you. And that's candidly why I've got to keep updating the book. Because what has changed this year is actually going to be sitting right here up in front at chapter 1. That the enrollment rules here have been modified as a result of the Bennis Act. I've spoken about it here on this channel. I've appeared as on thestreet.com, on Retirement Daily, Bob Powell. We'll get to him in a few minutes. That he's been good enough to ask me about this as we reviewed the effect that it has on these little hiccups when it comes to enrolling in Medicare. A complicated topic, and I'm going to speed through here without taking up too much more time because we've got to keep going. So 65 million people on Medicare, as is known. 2024 is not going to be 10,000 people a day turning 65. It's going to be 12,000 people a day turning 65. Why is Medicare different, etc., etc.? This is known here. What has changed here is the following: is how to use this book. These points here I have been trying to, on the bottom line is you need to keep up to date. The Bennis Act, the Inflation Reduction Act, will change a number of conclusions sitting in the book. It will change, for example, this is why I'm going to be changing, or I plan to change. I'm one of multiple chefs in this kitchen, and I'm probably not the head chef. But anyway, this Medicaid part is going to change because it's going to go to financial assistance programs. The Inflation Reduction Act has widened the number of people that will be eligible for extra help by something on the order of 300,000 people in the United States, according to the CMS. Today, not enough people who are eligible for extra help are actually enrolled in extra help. They don't understand that it exists. They don't understand how to apply. They don't understand the ripple effects and what it can bring to you. For those people who are eligible and are simply not enrolled. This doesn't serve them in a day and age when we are still talking about at least 5% inflation, eating away at retirement and savings, and candidly speaking, retirement savings portfolios. Here we go, and as a result, these mistakes can be costly. And this is what I'm saying here, as you know, right? I pointed it out in the last segment about Mr. X. Mistakes here on healthcare cost planning are enormous. It's in the tens of thousands of dollars. That is true. The flip side is also true. That doing it well is saving $10,000. I'm not here as David Downer, right? Which is that the positive side here about Medicare is that these rules, your access to the plan that will fit you to the best, the definitions are known. They're given to you. They're enforced by the federal government. I'm saying, as a person with derivative financial experience, that the rights and options are heavily skewed to the buyer, not the seller. Not the seller. This puts you, the person who understands what is going on for themselves. Like I said, this health, when we talked about this other area here and the health index and understanding your current health status, can you pair them together and get the most for yourself? Yes, you can. I'm sure of it. We've got a long list of people who've done just that. Let's just keep going here. Avoid mistake number 1. We're going to have to change this, I think. This is just continues to go on. And it's gotten actually more complicated, which is healthcare is not health insurance. It's one of the 2 mantras of Jay's Corner, right? Healthcare is not health insurance, and stocks for show, bonds for dough. So, healthcare is not health insurance. I've already discussed this. It's getting worse. It's getting worse because the different stakeholders are starting to co-own each other. Meaning, without naming names, big pharmaceutical, big pharmacy owning healthcare services. Big insurance company owning hospital systems, primary care physician practices. There's a reason that I have my own personal private thoughts about how to modify Medicare Advantage. It simply put is it is so complicated underneath the hood that putting together the car has interactions that people don't see. And unfortunately, it's not going to be the case, in my view, that the regulator, the supervisors are going to be able to keep up with the speed and the smarts and the resources of the groups, the stakeholders. And the rules here aren't built in a way to protect the consumer fully. That sounded like a bunch of jibber jabber. As I'm saying it, I'm like, oh no. It's the reason I don't really spend lots of time in saying this is the way the world should work. I have a view, of course. Of course I do. Right? I have a view on how these pieces can fit better. That is true. I'm also not sure that practical reality makes it almost impossible that my recommendations would be enacted. And third is, if you're a person living on Social Security alone, if you're a person who doesn't understand the language of Medicare, none of these first 2 points, none of what I think matter at all. Right? You're trying to make it work. I get that. I've met persons, spoken to persons from almost every walk of life. Can't say all, but I can say almost. It doesn't matter if you need every dollar in order to pay for groceries and your mobile phone bill. It simply doesn't. It doesn't matter that I'm writing a letter to, the CMS or to actuarial firms to ask them what they think about my ideas. None of that stuff matters. What does matter is that you understand Medicare so you can take away the best option for that fits you. And the best starting point is to not confuse healthcare with health insurance. To not confuse healthcare with health insurance. Unfortunately, we live in Twitterverse, where we've got doctors making popular hot takes and TikToks throwing rocks at insurance companies, when in fact, insurance companies may be owning that medical practice, which is a pretty ironic, perverse video when I see this stuff out in public. With that, not too much more. What I am going to say, and not announced here, except here today, which is that persons who subscribe to Jay's Corner, the paid version, right? Which I want to call $30 a year, where there's the information that I'm not comfortable in releasing in public. We're going to get to that in just a few moments. That the new edition of Maximize Your Medicare is yours for free. I will pay for everything. Postage, shipping, send it out to you anywhere in the United States, in the 48 states. Sorry, Alaska and Hawaii. Anywhere in the 48 states. I'll send you a book as soon as it's published, as soon as I get my hands on them, if you subscribe to Jay's Corner for the first year. No problem. That is nowhere in print. I intended to. I haven't had time. Second update on Medicare sits here. There are going to be new rules in 2024. The amount of noise in marketing is enormous, right? You can see it's been enormous. This is not new. Right here up on your screen, for example. Nope, not up on your screen at all, is it? On your screen, let's just see if we can get up there. Let's just see if we can get up here. Here we go. For example, this is a video where I have actually reviewed, Medicare commercials, and this was in what, 2021, something like that, on when Medicare commercials became, and largely this is dealing with Medicare Advantage. The controversy around Medicare Advantage and part marketing is fierce. You can see that in other videos I have actually discussed think tank articles where they are trying to overstate, leave out details to make suggestions that only marketing dollars and the way that we get compensated drives decisions for consumers. I find that not even-handed and full of omissions. And the point is that it's easy for the public to read and just to soak it in. The source is undeniably credible. In this particular case, I want to call it Commonwealth Fund. Very high quality think tank regarding healthcare cost information, or Kaiser. It's one of those two. I basically don't throw mud at any other groups because I find them unqualified. I'm only picking at those groups who are the super qualified. The tweak here to next year is down here. It's there in purple in your screen. The 4 provisions CMS is finalizing but modifying include permitting agents to make busy reply cards available at educational events, requiring an agent to tell prospective enrollees how many plans are available from the organization, extending the length of time agents are able to recontact beneficiaries to 12 months, allowing an agent to meet with beneficiary without 48-hour cooling off period. So that looks like a bunch of jibber jabber. The number one takeaway for me is the reinstatement of the 48-hour cooling period. Because what ends up happening is there's a piece of paper that all of our clients have to sign when it comes to either talking about Medicare Advantage plans or Part D plans, which is the standalone prescription plan. It's called a sales scope of employment. I need to have it signed, sealed, delivered to me. I then have to wait 48 hours before going back and making a conclusion with the client. The issue that raises is that these guys over here creating the commercials, they're not going to like this. And the reason for that, without playing the video in full, I've turned down the sound here to see Jimmy Walker, but we've turned down the issue with these types of commercials is that the organizations you're calling, they want the sealed application on that call. There is no doubt about this. right? There is no doubt about this. They don't want a follow-up call because you're talking about persons who are working on shifts. They may not necessarily be there at that particular time. And as a result, they don't want to put down the phone to have to wait 48 hours and then go to another and then help you make a decision. They want it done on the single phone call. This creates a problem because this modification on the 48-hour period right here, which I have now cooling off period, by reinstating the cooling off period, they have eliminated the idea that you will make a conclusion on one phone call. That can no longer occur. Do I think that there's going to be there's going to be wrongdoing around this? Yeah. There was before. There will be now. Because there are actual reasonable exceptions. Somebody calls the day before the end of the annual election period. They call on December 6th. If I have to wait for 48 hours, that makes it December 8th. The annual election period would have ended. This happens every year. This isn't a reasonable exception. Nevertheless, reinstating the 48-hour cooling off period will deter the activity, the success of these commercials. That said, there is a negative here, which is that a lot of the reason that I've created Maximize Your Medicare is because that people are not aware that these other features that are available and are subject to incredible competition. That people don't know this stuff even exists. And as a result, this is a problem. Right? Because especially to those persons who most need Medicare and Medicaid, somebody who has enormous, very high-cost dental needs, multiple thousands of dollars. They don't understand that there's embedded plus enhanced available, and that can be worth it. The world is so competitive that this tiny detail can be the difference between plan number 1 and plan 101 in Hillsborough County. And I'm not kidding about 101. I'm low. Right? So the fact that people don't know these features exist inside of plans, and if you cut down the amount of marketing and awareness to the people who most need, they're basically doing what? They're overspending down here by an enormous amount that they simply were not aware that they could have saved. And that's your issue.